Good morning, Mr. Wallace.
Oh, hello.
I'm Dr. Tree. Lovely to meet you.
Nice to meet you. Thank you.
So I'm one of the doctors that's working on the PACE study, and I know that one of my colleagues has already discussed it with you a little bit, but I gather you have some questions, is that correct?
Yeah, no, I've been reading through all the notes they gave me, and obviously things come up in your mind, don't they?
Of course.
My cancer, they said it was localised. Is that a good thing, a bad thing, or I'm not quite sure what it means.
Okay, so the patients we'd like to recruit to the PACE study all have early prostate cancer. And what that means to us is that the cancer is localised within the prostate gland itself. That means that if we aggressively treat the prostate gland, we stand a good chance of curing the cancer, which to us means taking it away forever. So the chance of success of any of the treatments in this study is very good.
I know I don't get to choose because
that's right.
It's picked as to, yes.
Yeah.
But if I am chosen to do the surgery arm, how long does that involve me being in hospital?
Yes, that varies in lots of different things, varies from hospital to hospital, and also on your medical history. But in general, if patients are fit and well in this hospital, they only stay in for 1 or 2 nights.
Oh, right.
So quite a short stay, but they do go home with a catheter in, and a catheter is a tube that takes the urine from the bladder out to a bag attached to your leg usually.
Right.
And you can manage that quite easily at home for a little while. By about 2 weeks after the operation, most patients have recovered sufficiently to have the catheter taken out and are getting back to normal.
Okay. And the rather bizarre thing in here is this thing about the gold.
Right, okay.
That worries me a little bit, and I don't know why. Can you tell me a little bit more about why they do that and what it's for?
Of course. Yeah, it's quite a straightforward procedure, and it's done via 2 routes. There's 2 ways we can do it. Firstly is via the back passage to put the seeds in, and that's very similar to the biopsy procedure that you've already had done, although most patients say it's not quite as bad as the biopsy, so that's good.
Good to know.
The other route we can put them in via is through the up between the legs, through the skin there, and that just once again varies from hospital to hospital. But via both routes, the reason we put them in is to increase the accuracy of the radiotherapy. It means that we can localise the prostate each day before your treatment and make sure we're hitting the targets.
Brilliant.
So the procedure is quite quick. It takes maybe 15 or 20 minutes in an outpatient clinic, and you can go straight home afterwards. We do sometimes see some bleeding after the procedure, and that can be in the stools, in the semen, or in the waterworks. And that can go on for a few days. It tends to be quite minor. If you're on any drugs that increase the risk of bleeding, so warfarin or aspirin or anything like that, we will ask you to stop those for a few days before the procedure to reduce the chance of bleeding. And if you have the seeds put in via the back passage route, we'll also give you some antibiotics to reduce the risk of any infection.
Okay. Does the gold stay in there?
It does stay in there, exactly. So the gold stays in for the rest of your life. It doesn't cause any trouble. It just sits there quietly having done its job. So.
Okay. It's a difficult question to ask, and it might be a silly question to ask, but are we talking about curing this?
We know that all of these treatments offered as part of the PACE study stand a good chance of curing the cancer. Okay, so we would estimate that chance would be in excess of 80%, or 8 out of 10 men. However, no treatment is a 100% guarantee, unfortunately, and sometimes even very early prostate cancers can return after treatment. Nevertheless, that's quite unlikely, and so we are confident that the treatment is likely to be successful.
Okay, and how do we know when it's working?
So prostate cancer tends to, in most cases, grow quite slowly, which is good from the cancer point of view, but it does mean that we have to monitor you over many years to be confident that the treatment has been a success. And that's why, as part of the PACE study, we want to carry on seeing you and keep in touch for very many years, up to 10 years, just to see how you're doing and to monitor the blood test, the PSA, which over time will give us an indication about how well the treatment has worked.
And how often do I have to come in for these follow-ups? What's the sort of routine?
Sure. So after you've completed your treatment, whatever that is, we will see you every couple of weeks for the first couple of months, and then every few months with diminishing frequency over the years. And every time we see you, we will ask you lots of questions about your bowels, your waterworks, and your sexual function. And we know that sometimes these things are difficult to talk about, but it is very important that we ask these questions so that we can get the full picture of all the treatments that are offered as part of this study, and we can compare them accurately. We'll also ask about your sort of general levels of well-being, so we can assess the quality of life that each patient gets after these treatments, and that will give us a better idea of which treatment comes out to be the best. We'll also monitor, as I said, your PSA and also your testosterone, which is the male hormone, and the PSA trend over time gives us a good estimation of how well the treatment has worked.
Right. That certainly makes things a little bit clearer. Obviously, it's a lot of information to take in, but thank you for the time in doing that.